Good evening. My name is Catherine Clark, RN. I come to you this day to provide an informative speech over the knowledge of bystanders and the general public knowing CPR. Those who know CPR are those who provide that dying chance. Recognizing cardiopulmonary arrest and responding swiftly and appropriately, knowing CPR and how to perform it immediately can save a life. Healthcare workers are typically required to know what CPR is, know what causes it, and know the signs to look for when someone is experiencing CPR. However, most of the general public and population do not. It is imperative, and I am a strong advocate as a nurse and a healthcare provider in my community, to educate the general public and bystanders that everyone has the capacity to know what CPR is, know what causes it, and know how to intervene and provide adequate CPR and be that dying chance that someone has to save their life prior to professional medical personnel arriving. So today I want to present a story. Something happened to my brother. He is a furniture builder. He has never been in a medical healthcare type setting. He's never worked in one. To my knowledge, he's never experienced anything traumatic like he did this day. But my brother was getting off work one day. He went to the supermarket. He was standing on an aisle in the supermarket and he heard a clash. He turned around and looked. There was a man laying on the floor in the supermarket. Immediately, as our first response as a human, my brother ran over to that man. The man would not respond. It was very obvious he was not breathing. My brother did not know to check for a pulse, but he assumed, that there was something bad wrong. What was my brother's first instinct? Typically what 99% of most of the general public and bystanders do. Picked up his phone and he called 911. He sat there, kneeled with that man, and waited until medical personnel arrived. Now, do we know the outcome of the fate of this person that fell in the grocery store? No, we do not. But when I found out about the accident and what happened and how my brother intervened, I was proud that he knew to call 911. But as his sister, and most importantly as a nurse, I feel like I had failed him. It is imperative to know that when that situation happens, whether it's someone falling in the grocery store, whether it's someone drowning, whether you find a loved one in the bed that is not waking up, it is imperative to know that you can intervene prior to professional help arriving and getting there to help you. So after a long talk with my brother, I decided that as an informative speech today, I wanted to present this information not just to him and that scenario that he had to endure, but to everyone in the general public. So, like I said, my name is Catherine Clark. I'm a registered nurse. I have been for 3 years. Prior to that, I've been in the healthcare 7 years. So I've been in the healthcare field for 10 years total. During that time, I've seen my fair share of patients arrive into the emergency room experiencing cardiopulmonary arrest. CPR is being provided en route. CPR is being provided on the stretchers while they're coming into the hospital, and I have had to respond as a provider and perform CPR multiple times throughout my career in my healthcare field as a nurse. So today, I want to inform the general public on what causes the need for CPR. What causes the need for CPR is cardiopulmonary arrest. Cardiopulmonary arrest, also known as cardiac arrest, is when the heart stops suddenly and breathing ceases. There are many causes to cardiopulmonary arrest. Cardiopulmonary arrest is caused by coronary artery disease, amongst the other congenital heart problems or obtained heart problems through lifestyle choices over the years, obesity, drug overdose, alcoholism, alcohol poisoning, motor vehicle accidents, falls, blunt force trauma, drowning. All of those are causes to cardiopulmonary arrest. When someone experiences cardiopulmonary arrest, simply just that. Their heart stops, their breathing stops, they become unresponsive. How do we combat cardiopulmonary arrest? We combat cardiopulmonary arrest by cardiopulmonary resuscitation. The CDC defines cardiopulmonary resuscitation as performing CPR. How do you perform CPR? Very simple, 2 easy steps. I have my handy dandy bunny today to give an example. So say you're in the supermarket, as my brother was, someone collapses. What do you do while you're waiting on medical personnel to arrive? First thing you do is call 911. Then you do those 2 simple steps of cardiopulmonary resuscitation, or CPR. It is apparent the person is in cardiac arrest. To check for a pulse, you use 2 fingers. You place it over one side of their neck, feel for the carotid artery. It's typically the strongest pulse in your body. Please do not place and listen to both sides at one time. Just do one side. Don't listen for longer than 10 seconds. Feel for longer than 10 seconds. If it's apparent they do not have a pulse, they're not responding, they're not breathing, you immediately start CPR. 2 simple steps. 30 chest compressions, 2 rescue breaths. The way we perform chest compressions, take both arms, lock them together. You find the middle of their sternum, which is typically in between the breast. You do not have to remove their shirt or their clothes. Just try to find the middle of the sternum or the middle of the breastbone, and that's where you're going to compress. So you lock your arms out, and you're going to do 30 chest compressions, and you just press down. These compressions, we like for them to be at least 2 inches deep, and you want to compress to at least 100 to 120 beats per minute. How do you count 100 to 120 beats per minute when you are experiencing a traumatic situation and your adrenaline is pumping? Well, as a nurse who has gone through this many times, it doesn't get any easier as far as the adrenaline part. But I do keep in mind, typically when I am performing CPR, there are 2 songs that you can play through your mind. One of them is Staying Alive by the Bee Gees. The other one is Baby Shark, which most of today's generation know. So while you're doing your chest compression, you go to that rhythm. You can even sing the song out loud. You do your 30 chest compressions. Once you're stopped, then you're going to do your 2 rescue breaths. Second step of CPR. To do a rescue breath, you're going to take the person's head, tilt it back, open their chin down. You're going to open their airway, pinch their nose off, clasp their mouth, and you're going to provide 2 rescue breaths. It's important that the rescue breath, when you do the first one, you're going to watch for their chest rise, fall, wait 3 seconds, do it again. Once you've done your 2 rescue breaths, you immediately resume CPR. Now, it is important to note that while most of the general public is not comfortable with performing rescue breaths on people that they do not know, the American Heart Association has recently released new guidelines as to performing adequate CPR. Those guidelines include compression-only CPR. What is that? Compression-only CPR is so easy. It's 1 step. Just do compressions. If it's someone you do not know or do not feel comfortable doing mouth-to-mouth on, or doing those rescue breaths, you simply just do compressions. You do them until you are compressed out, and you continue doing them until someone else arrives to help you or until medical personnel arrives. It is important to note that 45% of victims who have experienced cardiopulmonary arrest that were provided CPR by bystanders in the general public survived because someone stepped in prior to medical personnel arriving. That information was released by the American Heart Association. So as I said earlier, that's why I'm such an advocate for the general public knowing and bystanders knowing how to implement CPR in an emergency situation, because out of the 475,000 Americans that die each year, as the Howard Health Publishing released in a recent article, out of those 475,000 deaths each year due to cardiopulmonary arrest, that number could be drastically reduced by as much up to 45% if the general public were informed on CPR and how to do it and stepped in prior to medical personnel arriving. So today I come to you as not only a nurse, but as a mom, as a friend, as a sister, as a wife, as a member of the general public. This information is not just reserved for medical personnel, doctors, nurses, respiratory therapists, CNAs. This information is to be presented and given to anyone in the general public. You do not have to take special classes to know how to save someone's life. All you have to do is know the 2 simple steps. Now, I do want to provide a key point when you are providing CPR to someone. As the situation when my brother was in the grocery store, the person fell out on the floor. What my brother could have done, rolled the person flat on their back, laid on the ground, and started CPR had he known what to do. It is important to note when you do step in and provide that dying chance for someone, please make sure they are on a flat surface. If you walk in and your mom or your dad or your child, heaven forbid, or any of your loved ones have fallen victim to cardiopulmonary arrest in a bed or in a recliner or on a couch, it is imperative that you pull them off of that surface and put them on a flat, hard surface before you start CPR. CPR is only effective if they're on a flat, hard surface, because when you are doing those compressions on the middle of their chest, you're actually taking their rib cage and their sternum and pressing it to their heart and massaging their heart as if their heart was performing a normal beat. When you provide those rescue breaths, you're providing oxygenated air into their lungs so that when you continue chest compressions, that oxygenated air can be flowing through their bloodstream, through their body, as if their lung was actually beating, until emergency personnel arrives that can take over and provide advanced CPR. So today, I just want to remind everyone that recognizing cardiopulmonary arrest, responding swiftly and appropriately, knowing CPR and how to adequately perform it can save someone's life, because those who know CPR are those who provide that dying chance. So I just want to thank everyone for listening to my speech today. I hope that no one experiences anything as traumatic as what my brother did, but I do hope that if you do, you will know what to do. I hope that this speech helps you realize that anyone can save someone's life with 2 simple steps. So I hope everyone has a blessed day. Thank you.